In this video, we will be explaining why and how people develop complex regional pain syndrome, or also known as CRPS. Imagine your body is a city. You have the town hall, you have different neighborhoods, roads, and power lines, and they're all connecting everything together. In your body, the town hall is your brain. The neighborhoods are your limbs, the roads are veins and arteries, and the power lines are your nerves. Let's zoom in to the town hall. So just like your brain, every room in this building has a purpose. Every room is in charge of a neighborhood or a department of some sort, like transportation or hygiene or construction. The rooms are all connected by phone lines that send and receive information from other rooms to the rest of the city. Now imagine the city gets hit by a tornado. One of the neighborhoods receives a lot of damage. Normally, that neighborhood is going to send information to a specific room in town hall, and the alarm bells will start ringing in that room. They'll say something is wrong over here, send EMS and fire rescue, and the people working in that room will contact them and send them in for repairs. Once the area is repaired, the signal of danger is going to stop being sent and the alarms will stop ringing. A real-world example would be if you twist your ankle or you break a bone and this causes pain, which is the alarm bell in the town hall.
In a city that has CRPS, just like before, the tornado comes through, the alarms are set off, and EMS fire rescue is sent to the neighborhood. But in CRPS, after the EMS, fire rescue, and the repair workers have all done their jobs, the neighborhood will keep sending the signal of danger to town hall, even though it is fixed. Now, the longer this alarm rings, the people working in that room will start to assume all information coming from that place must ring the alarm bell. They will eventually flag most of the incoming information as danger, and the alarm will keep ringing. It does this over and over again to the point that adjacent rooms, above, below, beside, or across the hall, will also start ringing the alarm bells. It creates a pain loop where danger information gets reinforced because of the alarms, and it causes more and more pain. In a real body, that translates into someone breaking their ankle. The body repairs the bone and the surrounding tissue. This usually takes 6 to 8 weeks, but a person with CRPS will keep on feeling that pain to the ankle far after the tissue has been repaired. They do not always feel pain, but it can be multiple symptoms that we will explain further.
So CRPS has 4 components. The first is neuroplasticity, which is the brain's ability to change and adapt by forming new neuronal connections. This is great when you're learning something new, but in CRPS, it means that our town hall is making and reinforcing bad connections between the incoming information from the neighborhoods and what is really going on. The second component is neuroinflammation, which is an inflammatory response of our nervous system. If you can imagine our city, it's the equivalent of an electrical pole being miswired and sending wrong information to City Hall, which is reinforcing that pain loop.
The third component is autonomic response. So, in our body, there are systems that keep everything regulated. This is all happening unconsciously and includes things like our heart beating, digestion, our body temperature. This all happens when we are in a relaxed state. When we are not relaxed, example, we've broken our ankle or in a dangerous situation, our body enters the fight, flight, or freeze state. The not so pressing tasks of daily life get put on the back burner until the threat has gone down. Think about this. When you break your ankle, you don't feel hungry much until later, after the threat level has gone down. In people who have CRPS, they live most of the time in this fight, flight, or freeze state. which is why they can develop symptoms like redness, sweating, changes in body temperature, difficulties with digestion, and sleep. If you think about our city, there's a lot of action happening behind the scenes. The construction workers are doing daily maintenance, the garbage trucks are running, etc. In the CRPS city, there's a bigger threat happening, so all these workers are working to bring the threat down instead of their daily tasks of the day. So the other tasks get left behind and the city doesn't run as smoothly. The fourth component is immune response. In our city, once the tornado is gone, a cleanup crew will go in and remove the debris and trash. If that cleanup crew is sent there when there is no damage and they are cleaning for no reason, then they will be cleaning up things that don't need to be cleaned up. In our body, the immune response comes in and cleans up the injury site so that the area is ready for the rebuilding phase. However, in CRPS, the injury site has already been cleaned up and rebuilt, but the immune system continues to work, leading to inflammation that causes hypersensitivity of the skin, the release of chemicals that provoke hair growth, blood flow and sweating, and other chemicals that lead to the breakdown of bone, making the person more susceptible to osteoporosis, and the increase in connective tissue production, leading to the tightening of the joints.
These four components aren't always present with patients who have CRPS. They may only experience a select few. To sum up, let's say you broke your ankle and then developed CRPS after a couple months. We know that the bone and the other tissue in your ankle have healed. Except in CRPS, the treatment isn't going to be to increase strength or increase range of motion of your ankle, because these are not the issue anymore. Your physiotherapist and yourself are going to work together to try to break down the bad connections formed in your brain in order to stop the pain loop that is created between your ankle and the brain. It will be about teaching your brain that not all information coming from this body part should ring the alarms. In our city, we need to retrain the city hall to view the affected neighborhood as safe, fixed, cleaned up, and functional again, so that they don't keep ringing the alarms when information from that area is sent to City Hall. We hope this video has been helpful and has helped you understand the very complex pathophysiology of CRPS.